So it's such a muscular activity, just looking at things. And it affects all the muscles in the body. You need secure posture. You need to be able to control your body, to control your head, to control the direction in which your eyes are moving. And vision drives posture. We can hear things in just about any position. We can be upside down. We can have our backs to the sound source. We can be in the next room. You can't do that with vision. And I know that's obvious, but we have to remember you need to organize all the muscle systems in your body in order to direct your eyes to the thing you want to see. And we also have to remember that the eyes themselves are controlled by the ocular muscles, as seen in this diagram. And because muscle tone tends to be low in children with charge, it's quite likely that even the movement of the eyes themselves might be affected negatively for children. And it might be easier for them to move their head rather than to move their eyes in the eye socket, as it were. So there may be issues with the eye movement. There may also be issues with accommodation in the eye. That ability we have because of muscles that pull on the lens at the front of the eye, our ability to look at our hand and see it in focus, and then look up and look 10 feet away at the television screen and see that in focus. And we're seeing at different distances in focus because our eyes can accommodate, because the muscles that control the lens can tighten or relax the lens to allow it to work at different focal length. And there's no reason why people with charge should not be nearsighted or farsighted. And I would just say, if there's a feeling that the child needs glasses, when you talk to the vision professional, you need to make it clear why you think they need glasses, because the child's got collobomas, probably, the doctors often assume that you're asking if glasses will help with the coloboma, which they won't. And I know a number of families where I've recommended they talk about the need for glasses, and they've gone, but they haven't said why. And the doctors assured them that glasses won't make any difference to the visual field loss that the child has. So you do need to be clear about it. And then we know that developing good equilibrium or good balance comes really from a combination of senses. The proprioceptive and vestibular senses, which I talk about in another module, and the visual sense. And vision plays a big part in keeping us upright and keeping us well balanced, although we usually don't realize that's what it's doing. And it's easy to test, because if you're walking in a fairly unfamiliar place and the lights suddenly go out and it goes pitch black, the first thing you want to do is find a wall, you reach out for a wall, and you go and lean on it and trail along it so you don't fall. That major part of your balance system has suddenly been taken away. And I know children with charge who, with significant vestibular damage, with low vision, and with proprioceptive and touch difficulties, have learned to walk and can walk and even run quite well inside a building, but can't do that outside. And before they fall down, they sit on the floor and they often crawl or they scoot along on their bottom. And people often think the child's being lazy. And the explanation usually is that inside the building, the child is using strong vertical lines, like the corners of the room, the sides of the window frame, the sides of the door. That visual information is giving their brain a good idea which way is up and which way is down. But when they go outside and there are no strong vertical visual clues, they lose their balance. They're no longer safe. It took me many years to notice that and realize that's what was happening. Of course, another problem when the children go out of the building might be that it's too bright. And if they have problems with light perception, then they may be photophobic, is the phrase that's used, meaning their eyes can't cope with bright light, which could be another reason why they refuse to go out or they drop to the floor. In the other module about the other senses, I talk about the vestibular sense, and I talk about a reflex called the vestibulo-ocular reflex. And this is a reflex controlled by our vestibular sense in our inner ears, which helps us to look at something and fix our gaze, our visual attention on something, and then move around, walk around, bend down, stand up, while we are still looking at the same thing. And if our vestibular system is not there or is not working properly, when our head moves around, it's going to take our eyes with it, and our visual attention is going to be pulled away. And children with charge experience this problem very early on because of vestibular problems and low muscle tone. They don't have good body control. They don't have good postural control. They don't have good head control. So their eyes are constantly being pulled away from what they're looking at. So they will lay down and get their head supported, or they will prop on their hands, or they will lean their head down on the desk and hold the book or the iPad on its side next to the face, and so on. And what they're doing is fixing their body to fix their head, to fix their eyes, so that they can use their vision in the most reliable, most effective way without it being pulled away. And I've got a series of pictures here of children looking at books in a variety of different positions, all of them bringing one ankle up on the other knee to get basic postural security established. Two of them are laying down, and they're all getting themselves securely fixed before they use their vision. The last photo shows a child on their back on the floor. Someone's asked the child if they can take a photo, and the child is immediately swiveled around with her head towards the camera so that she can arch her head up, arch her neck, and look over the top of her head. Again, she's fixing her body to get everything stable. It's the opposite of the way we would think of posing, which would be feet towards the camera and our heads back. And then a very old photograph of a young man hanging over the edge of a couch in order to watch a television screen. And I make the point that this is a normal viewing posture if you have no vestibular sense, upper visual field loss, poor tactile and proprioceptive perception, and low muscle tone. And then the last two pictures show children propping. The first young man is reading a book, and it's very noticeable that he has his hand sitting under his chin and his elbow on the table in order to try and keep the head as fixed as possible. The next picture is an older boy doing his homework at home. And I was sent this photo, and the boy's mother said to me, why, when he's doing his homework, does he always he writes with his right hand, why does he always use his left hand at the top of his forehead to support his head? And the answer, of course, is that when he has to lean forwards to look down at his homework, the weight of his head immediately destabilizes his posture, and he has to work ever so hard both to maintain posture and keep his head in position, but also to stop the head moving at all and pulling his eyes away from the work that he's doing. And just looking at the photo, I was able to make two recommendations. First of all, I would take that tablecloth off the table, and I would go for a plain surface, either wood or a plain cloth that's all one color with no pattern, because that creates quite a lot of visual confusion. But more importantly, I would raise the tabletop. I would have some kind of angled desktop so that instead of the work being down on the table, it's raised up in front of him so he doesn't have to lean forwards and bend his head forwards. And that can make a huge difference in making it much easier for the child to use vision for something like reading or doing fine vision tasks. And those kind of angled desktops are very much the provision of traveling teachers of the visually impaired, or maybe occupational therapists trained in low vision. And then in conclusion, two more points. I said at the very beginning I would talk about the brain. I've mentioned the brain a lot, particularly the optic nerve. It's good to remember that we don't see with our eyes, we see with our brains. You need eyes to collect the visual information. Things like an eye, a lens, a retina, an optic nerve need to be there on some level in order to perceive visually, but it's the brain that does the active seeing. So if you're trying to assess a child's functional vision and their visual potentials, unless you're an eye specialist like an ophthalmologist or an optometrist, you have to think about the whole child. And I have a very nice old quote from one of the great pioneers in the blind low vision world, Natalie Barriger. I'll read you the quote and then I'll expand on it a little. She says, visual functioning is related in part to the condition of the eye, and we know that. More explicitly, visual functioning is determined by the experiences, motivations, needs, and expectations of each individual in relation to whatever visual capacity is available to satisfy curiosity and accomplish activities for personal satisfaction. And so many of those words I've picked out by underlining them relate to the emotional heart of the child. These are very directed to that child as a person, as a human being. And what this quote is telling us is, yes, the condition of the eyes is a really important factor, but there are all sorts of other things to do with expectations and prior experience and motivators that can determine how confident a child is in using their vision or not, or how willing they are to put a lot of effort into using their vision or not. And if we get this right, we can help children want to use their vision. And that's the goal for teachers. How can we help children want to use their vision? Because low vision is innately very challenging and tiring to use, particularly over an extended period of time. And in complete conclusion, I just want to go very quickly, as I said I would, through the vision professionals. You may know this, but I'll go through it very quickly. The ophthalmologist is a doctor and usually a surgeon. They're the ones who perform eye surgery. They would be your vision specialist for a child, based usually in a hospital. And they would be the people who do the in-depth examination of the eye and would do any of the surgical interventions that I've talked about in this module. The optometrist is more concerned with functional vision, and especially the movements of the eyes, the way the eyes move, and the things that permits or that limited movement prevents happening. The optician is the dispenser of vision aids. And although an ophthalmologist and an optometrist might well talk and recommend vision aids, it's usually the optician who actually handles that. And many of us are familiar with opticians because we wear glasses ourselves. There are vision rehabilitation professionals who also can provide vision aids and can do vision training. Sometimes, if you're lucky, they're rare, but you can find an occupational therapist who's trained specifically in low vision. Then there are teachers of the visually impaired. They're usually itinerant. That means they wander around from school to school or home to home. There is a deaf equivalent of teachers who also travel around with deaf children, and they can give all sorts of support and help and ideas. They can lend equipment. And I've worked with many wonderful teachers of the visually impaired through my career. And then finally, the orientation and mobility instructor. For shorthand, it's often called O&M. And obviously from the name, orientation and mobility means using vision as much as possible to work out where you are, and then to work out where you want to go and how to get there. And they're intensely practical. They're wonderful people to work with. It's a great specialism in the education field. And they're the people who, amongst other things, will train teachers to use the long cane, the blind cane, as people often call it. So although you can go online and find a lot more information about those people, I thought it might be helpful to finish with that little list to give you an idea. I hope this was helpful. There is information in your resources that you can turn to. From my articles, there's one about vision in charge. There's one about the vestibular sense and one about the proprioceptive sense. So I recommend those if you want further information. Thank you.